Tuberculosis is an infectious disease that can cause infection in lungs or other tissues. It commonly affects your lungs, but it can also affect other organs like the spine, brain, or kidney. The word tuberculosis comes from a Latin word from model, or something that sticks out. Hello and welcome to Inside Today. I am Jumai Mansden. Stay tuned. Inside Today continues shortly. You're welcome back, and if you're just tuning in, this is Inside Today on Global Television. Now, the theme for the United Nations Tuberculosis Day is Yes, We Can End Tuberculosis, and known as TB. And I'm not doing it alone today. I have my colleague, no other than Queen Agaba, who is here with me, that will be just creating a little awareness when it comes to tuberculosis. How are you doing, Queen?
Hello, I'm very well, thank you.
It's great to have you on the program.
Yes, I feel excited, being on the program with you.
All right, now looking at World Tuberculosis Day, it's celebrated every 24th of March, and then that's for the United Nations create awareness to individuals who suffer from this disease. And looking at it, and there's some individuals in the rural urban area who do not know they actually have this disease, making it contagious and all of that stuff. And of course, in view of it, now the disease, which we know is caused by germs that are spread from person to person through the air. Now, TB usually affects other parts of the body, such as the brain, the kidney, or the spine. Now, tuberculosis is caused by a bacterium called Microbacterium. People with active TB in a lungs or vox box can spread the disease. They release tiny droplets that carry the bacteria through the air. This can happen when you're speaking, singing, laughing, coughing, or sneezing. Yes. Now, people also ask, what are the main causes of tuberculosis? And we have mentioned that, but a few. Now, looking at it critically, Queen, we've talked about this issue, tuberculosis, known as TB. There's this stigma that is attached to it. People, when you hear, this person has TB, you run off thinking that there is no cure. From people that I've seen, do you think the government doesn't create that awareness when it comes to tuberculosis?
Yes, on the program today, Global Morning this morning, I think we talked a bit about tuberculosis, and we even had a medical doctor come on board to talk about tuberculosis. And I think one focal area should be awareness. Like now, we in urban areas, urban centers, offices, we know about tuberculosis. There's some information I was not privy to, except for now, that I know on the program this morning, that I knew about, when he was saying that the free medicines for people with tuberculosis, free drugs. I never knew that if you have tuberculosis, you could get treated for free, and it's curable.
Yes, it is.
Yes, it's absolutely curable. So a lot of people, now what we're advocating for was, and asking for was, how much of awareness is taken to the grassroots? Do these people know about, tuberculosis, how you can be infected, how contagious it is, what to do, and then the long side effect on the long run, what can be damaged in your system if you don't take care of it. We talked about, I remember that one of the things that the Dr. Daniel Faithful that we had, one of the things he mentioned was the fact that people with tuberculosis, because in the initial stage, even in the workplace, when you see people coughing for 1 minute, 2 minutes, or coughing for, say, going to 7 days now, it's a sign. If you cough consistently for 3 days, don't think you have a cold only. No, you should go for proper checkup. And then he said this, I'm guilty to an extent, but when I have a cough or I have I just want to take something like ginger tea. Yes, and it's common. A lot of people tell you, I think you've told me this a couple of times. Yeah. And so when he was talking about those self-medications, especially when the cough persists, I knew that I was guilty, or I have been guilty of such occurrences. So, but what he is saying is, and what people are saying is, when you have or you see that you've been coughing consistently for, let's say, a period of 3 days, it's a sign that you should check yourself and not just give yourself ginger and honey, sugar, and all of those treatments. You should check yourself. And if you have a colleague, it's a responsibility. If you have a colleague who has been coughing consistently for 3 days, you should go get checked. Now, that information I didn't know was needful. Don't say that. Yeah, very vital. Don't say that because you're not the one coughing. You could have been infected if you don't protect yourself, if you don't go get checked. And that's, you getting checked could also, bring about some sort of relief for that colleague, because you now know this is what is obtainable, and that colleague could get checked as well.
You know what, I will try and play a clip from this morning, Global Morning, and that clip where the doctor spoke extensively when it comes to tuberculosis and the awareness in which we're trying to create when it comes to TB, which is, it's very important that not everyone infected with TB bacteria becomes sick. Now, if you're wondering, can TB be cured, like you have said? Now, the first cause of tuberculosis, and looking at ways that you can prevent it, of course, active drugs, sensitive TB diseases treated with standard 6 months course of 4 antimicrobial drugs that are provided with information, supervision, and support to the patient by a health worker or trained volunteer. Now, it's not everyone that can just go to a pharmacy and just, take these particular drugs that has to do with TB, or like I say, you have to be monitored by a health worker, which is very important, because some of these drugs are like psycho drugs, the drugs that are not seen in places. It has to be monitored. You have to take the right prescriptions, which are very important. Now, the vast majority of TB cases can be cured when medicines are provided and taken properly. Now, most of us, of course, we say to ourselves, we do not take medications, or we do this self-medication, which you spoke about, which is wrong in all angle to self-medicate. And that is why it's important that you go to the hospital. Don't be scared. And growing up, people will tell you TB is like dried cough. There are no mucus coming out of it. It's dry. So you know that there is something wrong. The whole throat and everything is dried. So of course, that is an area of concern, because the pressure in which you put on the brain, the spine, the stomach, everything compresses together. The pain involved in it. So it's something. But at the same time, it's like a stigma, because no one wants to be associated with someone that has TB. Now, of course, we'll try as much as possible to play a clip from the Global Morning to hear what the doctor said in time in the program. Now, from research, it says there are 3 stages of TB, which it has to do with exposure, latent and active disease. A TB skin test or a TB blood test can diagnose the disease. Now, for someone out there who is wondering, a skin test, just the skin, like a swab, you get the skin, and you just have like a scrape out of it and go to meet the doctor. Basically, the lab will do all of that when it comes to that. And blood tests can diagnose the disease. Now, treatment exactly as recommended is necessary to cure the disease, to prevent its spread to other people. Now, that's the part that is dangerous, the spread to other people, even children. There was a time I was in the university, I met a little child, less than 4 months. And the way the child was coughing, a little baby. The mother was traveling with the child. We're traveling from Maiduguri to Kaduna. Then, of course, there are no airports that will take you, so you have to go by road. That's about 7 hours. And the way that child was coughing with all the stress, I just knew this cannot be an ordinary cough. I'm sure maybe the cycle in which the child found herself or himself, like maybe the father, the mother, or parent. So it's very important that once you have cough, it doesn't matter the kind of cough that you have, please ensure you do the needful by covering your mouth. They've made face masks available. It's not when there is coronavirus that we cover our mouth. Some of these little coughs, we have to be very cautious when it comes to it. TB is dangerous. It can kill if it's not properly managed. Right, Queen?
Yeah, very, very true. TB is dangerous and it can kill if it's not properly managed. And you know, the sad thing is that you have a child, if you've been coughing like that consistently, you should be more careful. I'm beginning to wonder, how did a little baby of that nature get that, you know,
it was
that,
bad. The cough was bad.
Cough too. So now when you're treating yourself for TB, or you're treating yourself, even when you don't know, you've not been diagnosed yet for TB, you're treating yourself of a cough of such nature, you should know that you're protecting not just yourself, you're protecting your entire community, because it spreads, and you know the danger that it imposes on not just you, but your family as well. And one of the things that still on awareness, still on speaking on TB awareness and all that, I think a lot more awareness needs to be done. And you begin to wonder why the theme for this year is End TB. And
Yes,
it was
yes,
the same
we can.
theme for Yes, We Can End TB. It was the same theme for last year, if you recall, 2023, I beg your pardon, is Yes, We Can End TB. And this year, 2024, is Yes, We Can End TB. So we're having two same teams at a row. That's just to tell you that the emphasis, to tell you about the emphasis that is being placed on ending tuberculosis. You know, one of the things that Dr. Daniel mentioned is that, you know, sub-Saharan countries, here in sub-Saharan Africa, TB is very prevalent,
Yes,
you know,
it is.
and then the spread, I don't know, because
it's a tropical region, because of the heat and all of that.
Exactly. And then
have.
aside from it being a tropical region, I think it has to be the awareness, how much awareness is being pushed out, how much education is being given as regards tuberculosis and all that. Not just tuberculosis. Now, I know we're talking about tuberculosis, but this extends to other diseases that, you know, I think awareness, for some programs that we see, we should see at least some certain percentage of tuberculosis awareness on TV. I don't see it all the time.
I don't
either. Even on radio, there should be a program for tuberculosis where it is being interpreted in various languages so that people, because you find that the people who actually have this tuberculosis are people quite all right, sub-Saharan Africa, but in the rural areas, the very grassroots, these are the people that battle with tuberculosis. But he mentioned that there's some intervention programs that are put in place to ensure that, you know, they drive vaccines, they drive education and all that to those places, but are they
functional?
Yes.
Now, looking
exactly.
at it critically, when we look at tuberculosis, it's very important that we understand that it takes you and I. It's not about the awareness that we cause, the sort of way we approach this this spread of TB to make it easier for people to understand that tuberculosis is real and it's deadly. Now, early diagnosis, like you mentioned, now TB testing can identify latent TB, so a person can get prompt treatment. So there are degrees. So it depends on the degree in which you fall in to get prompt treatment or a process which it will take. Now, the workplace prevention and control, some jobs such as in healthcare increase a staff member's chances of TB exposure due to the tight-knit space in which you find yourself. So one person coughs, it spreads around and it becomes an issue. Now, it's very important to understand that physical distancing, air quality measures, UV light, it's very important for that to cure that. When you say UV light, the rays, you know, the inner light that you use and all of that. Now, people with TB disease need to take several medicines when they start treatment. After taking TB medicines for several weeks, a doctor will be able to tell the TB patient when they are no longer able to spread TB germs to others. Now, it's very important to know that once you are receiving treatment from TB, you should maintain that distance. It doesn't matter whether you're living in the same house, there's always a way. Cups, spoons, it's not like HIV and AIDS that you can get away using someone else's cup, spoon, and all of that. This this is contagious. It has to do with the saliva.
Airborne.
It has to do with it is airborne. So it's very important that you take precautionary measure. All right, now let's quickly go on a quick break and let's see if we can get that clip from the doctor this morning. Remember, it's Inside Today, and of course, the United Nations yesterday, which was March 24th, celebrated International Tuberculosis Day, and it says, yes, we can end tuberculosis. Let's have it at the back of our mind. Tuberculosis is the short abbreviation is TB. Don't go anywhere. Inside Today continues shortly. All right, you're welcome back, and if you're just tuning in, this is Inside Today, and today we're looking at tuberculosis. Yes, that's what is in view today, talking about TB, which is namely the common name for this particular disease. And we're going to get a clip from this morning, Global Morning, that's Mr. Daniel spoke on tuberculosis, so we'll understand the nitty-gritty when it comes to this particular disease. Now, it's very important that you know that it's very important for us to know that doctors will be able to tell patients when they are no longer able to spread TB germs to others. So it's not your call to take when you're done with your drugs. It's not your call to say, okay, I'm done with my drugs. I can now mingle. I can now gist with Queen. I can now talk with people in my office. No, 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 no. You have to still maintain that distance till you get checked and the doctor tells you, okay, now you are cleared. And that is why there's so much spread, especially in the rural areas where you talk about individuals who are not properly checked by these health workers, by these doctors. They just feel once the drugs are given, I'm good, I'm done, I'm not coughing anymore. They don't understand that it takes a process. I think that's where the issue lies.
Yes, that's where the issue lies. And, you know, he was trying to offer a solution. One of the things he said, you know, you need to, usually in developed or senior clients, you have, where you have a case of TB or you're diagnosed with tuberculosis, you go to a healthcare facility, a doctor will be assigned to you, or, you know, someone that would follow up to see to it that you take your drugs regularly. This person would follow up, check up, go as far as coming to see you and all of that. But here, that is what we talk about, where our resources are limited in terms of hands, medical hands. There are not enough doctors to cater to patients. And then, but now this is where innovation comes in. You have video calls where you ensure that you mark register, you show yourself on a video daily. If you're going to take that dose daily, you have a video call with your specialist or your doctor or the person who follows up to see that you have taken such prescription. So when you show it, this is me. That's a good way to follow up. But now when we try to drive this to the rural areas, you see that there's no network connectivity. Exactly. How many of them have these phones? How many of them are internet inclined and all of that? So it makes it even difficult to do follow-up. And then because we lack hands, you know, to follow up, how many of these people would travel down daily to these rural areas or even the centers, because we have clinics around, you know, but what we're talking about now is hands that are going to monitor the process to see that. But I believe we can, and there are a lot of organizations that are putting in their works and doing their best to ensure that, you know, they drive and push this goal, which is to end TB this year. Not this year, foreseeably in the future, I mean, but at least to end it, to put a halt to it to an extent this year, you know, as a goal. So I think, and this brings me to the question of asking or saying that we all as individuals have a role to play.
Yes, we do.
You know, I was talking to one of the pharmacists on Global Morning this morning that we had this morning. I was talking about the affordability of these drugs. How affordable are they?
True.
You know, but I learned that these drugs are totally free. Like I put it earlier.
Yes,
so
it
it was here. I learned that it's free. How many people know that tuberculosis drugs are free? So
We need
I
the
don't think
awareness.
that if you know that these drugs are free, you sit down in your house, or else you're just negligent. You sit down in your house and take honey and take ginger, because you buy this ginger one way or the other.
But you know what, Queen? I think it's the fear of the stigmatization that is involved.
True. We don't talk much about stigma.
We
So,
don't.
but this is where awareness comes in. If we need to push the awareness that tuberculosis is not a death sentence, or else you want to make it look like. I think gone are the days when if you have TB, it should be a critical or something that you should be afraid of.
It's just a cough that brings
It's just
you
a
up.
cough that brings, yes, and if you don't get treated, that's when it becomes an issue.
Sorry to cut you. Sorry.
Please go on.
And I think it's the length of time, 6 months. It's a long time. And it's six months can be a problem of consistency when you have to take those drugs for 6 months. Let's say morning, afternoon, and in the evening, morning, afternoon. Sometimes some people are not consistent when it comes to drugs.
Exactly,
like
but this
that.
is your health we're talking about, and in the long run, what do you stand to benefit? You know, consistency could be an issue or could be a big deal. But this is where, like the doctor mentioned, this is where follow-up is necessary, so that we don't have people who are to be drugs resistant, because if you're not consistent, your system can build a resistance.
Very true.
Where you're now giving accurate drugs, but your system will not be able to suppress. Yes, exactly. So consistency is very important, so that people are not resistant to tuberculosis drugs. So this is a call for a lot of work to be put in. If we're saying that the team is end tuberculosis, yes, we can end tuberculosis. Then, especially in sub-Saharan Africa, Nigeria as a whole, and in the rural areas, efforts needs to be put.
A lot of effort.
There, enlightenment, awareness, campaign, on and on, daily, monthly, I beg your pardon, but what I'm saying is consistently, awareness needs to be put and follow up to ensure that people understand the importance of consistency. If you're not consistent, it means that your body will not be able to fight TB whenever you're given a drug
accept the drugs
whenever you're given that.
And then looking at it critically, Queen, I'm just thinking, I think March 24th that the UN has signatured or put as the World International Tuberculosis Day is not enough. I think because this is a health hazard and it's contagious, like we mentioned, it's an airborne disease, I think it should be something that we can do maybe twice or thrice in a year to give that proper awareness. Because after March 24th, and now because it was on a Sunday, we have to talk about it today on a Monday. So now I think it needs Now, what happens after this now? What's the government doing after this? I can remember back in the day, the only time I saw a TB commercial was once, and it played twice, and that till date, I've not heard anything. Aside yesterday, where it was 24th World Tuberculosis Day, and aside that is all. So I think the stigmatization is what has made individuals go into hiding. They would rather cough it out or take, like I said, local concussions to enable them to get better. And funny enough, you know how the mind works. It's just like substance abuse. It's all in the mind. When you say to yourself, I am taking this drug or I'm taking this concoction and I'm getting better. That's where you go to the side, where you meet a different, off the counter, and then you take different prescriptions, and it starts working. And then the cough begins to reduce. The dry cough begins to get better, and it starts decreasing. And in your mind, you say to yourself, oh, I'm better. So it's better I do it this way so that people around me will not have that sort of feeling that, okay, I am a threat to their lives, because no one wants that. Of course, like I mentioned, stigmatization is what has caused this particular disease to spread so much that individuals are not comfortable coming out, even if the drugs are free. How many people have benefited from these drugs?
But, I think that that should not be an issue if awareness is proper awareness is given out. I see a lot of people these days. I remember back in the days when HIV used to be like a very dreaded, it still is, but it used to be very pronounced, like the dread and all that. Oh, you have HIV. A lot of people, you know, stigmatizing and, you know, going into seclusions from people who have HIV. But now, I think a lot of people are bolder now. You see on the internet, people tell you that, oh, I'm HIV, AIDS. They come out and say this is their stance, this is their status. They tell you their HIV status, you know, in all confidence and positivity, and they're trying to create awareness. We see this from celebrities. Quite a number of them have come out to say, this is what I'm going through. And this is, and then you see that people who have HIV, you know, when we used to have this healthcare system, go heart to heart, those healthcare, you know, in communities where you can go talk about, you know, you see a lot of people sneak in. Back in the days, they sneak into this heart-to-heart center so that people don't find them and see that they're going to take in their, you know, antiretroviral drugs and all that. But these days, a lot of people, and this is because we're seeing celebrities coming. Now, celebrities are, of course, we know how much influence they have. And I'm sure we've had celebrities who have had tuberculosis, one disease or the other, and how they dealt with it.
A lot of them.
It would be nice to now see these people come out and tell us, to talk about their journeys and how, you know, they were able to come this far, overcome whatever it is they might have gone through. And that is why I have a soft spot, and I always like to see, you know, vulnerability to an extent, because it helps. We cannot always continue to show the glitz and the glamour and all of this.
Very true.
They are topical issues. They are critical issues that would save lives and will help people. If we have a celebrity who has had tuberculosis, come out and say, this is, and tell you about how you need to, oh, you don't need to be afraid. You don't need to fear about stigma. You can come out of it. I mean, it's curable. How much more HIV and other diseases that, you know, that can be managed but don't have cures yet. I mean, tuberculosis is curable. So I think it's a call for people to, you know, be more vulnerable, especially when you have the influence, or especially when you've gone through that process and you've come out of it, and then tell people how to go about it, what to do, and let them know that they are not alone. And it kind of, for example, tuberculosis, you will not die if you get treatment. You would only die if you neglect it, or you might only cause long-term damages. But if you're consistent, you get treated, and you would even save yourself, your family, and your community at large.
That pain. And now looking at this critically, Queen, for me, I think this year, the theme, yes, we can fight tuberculosis, the awareness is not so much.
Exactly.
The noise, we should, not noise, but the show of love, the acceptance of everything is going to be fine, it's not enough. Like you mentioned the celebs, for instance, coming out, being ambassadors of say no to tuberculosis, let us fight to win this battle together. I have not seen anyone who has rightly come out to say, okay, I suffer. That's the stigmatization I am talking about. No one has rightly come out to say, okay, fine, I suffered from TB, but now I am fine. All you need to do, it's a process. You need to get diagnosed. You need to get checked. There are medicines that are prescribed by your doctor or health worker. You have to follow. You have to be consistent, so that you can get better, you can be cured, and you can be healed. And then, when you're done with your meds, it's not all about coming out with a bold chest and saying, I'm done with my meds, I'm free. You have to go back to check. At a point, I knew someone who had TB. And after 6 months, the person went through all the process, got checked, had to go back after 3 or 4 months to confirm again, even when he was cleared, has to go back to the doctor, because you have to get checked again whether it has resumed or it has gone finally. So I think people need to, that awareness is very important, and celebs have a lot of role to play. Just like you said, HIV and AIDS, people now don't, it's no more a hidden agenda. So it's something like, it's just like the malaria you see. Managed, it's well, if you can manage it. But most people in the rural area, they cannot manage it because they are not educated. The literacy is on the rise. And that is why it's very important we break this sort of information in different dialects so that people can understand, make the English simplified to say no to tuberculosis and, of course, TB for short. Let's quickly go on a quick break and see if we can get our clip so we can listen to a professional who is a doctor. Don't go anywhere. Inside Today continues shortly. Right, you are welcome back to Insight Today on Global Television. Now, this is the much Queen and I we know when it comes to tuberculosis because we made our research, we interacted with individuals. And at this juncture, we will be handing you over to the guest that came in the morning that spoke about tuberculosis, which is very important, known as TB for short. And of course, his name is Dr. Daniel Faithful. He was on Global Morning. So let's quickly do a recap on what he spoke about, the disease called tuberculosis. Do not go anywhere. Just let's sit back and watch this clip.
For helping us to, allowing us alter your schedule a bit this morning. We understand it's a busy Monday for you, no doubt about that. But my colleague, Queen Agaba, and I will just engage you for the next few minutes so you can get back to your work. So let's talk about where we are with regards to tuberculosis beyond the annual observation of the annual observance of that day.
All right, so basically, I would say we've come a long way since 1882. It's more than 100 years, since 150 years since Mycobacterium tuberculosis, that's the organism, was implicated, and the world has been looking forward to a cure. The goal has been to eradicate tuberculosis completely, to reach an extent where we know and we are certain that there is no longer tuberculosis on anywhere in the planet. And yes, we've made some significant achievements and significant strides. Since 1882, we've been able to save 75 million lives from tuberculosis scourge, but we're not yet there in that tuberculosis is not yet eliminated. About 2.2 million persons still got infected with tuberculosis in the year 2022, and that's quite a significant number. And we are quite bothered. We are bothered, especially medical practitioners like us, healthcare practitioners like us who are in low resource settings, low and middle income countries where we see that tuberculosis and other infectious diseases are more endemic, countries like Nigeria, the broader sub-Saharan Africa. So it's quite a concern for us. So whereas more developed countries like the United States, like France and all of that, can say yes, they are inching closer to eliminating tuberculosis in their regions, and it's still a problem, even as 1 in 10 persons who have latent tuberculosis, which we may discuss later, proceed to have the fulminant, that's a tuberculosis disease, TB disease, later on in life. Our problem is much more significant, and it's because of our more peculiar circumstances that we're in. Our healthcare system is much more fragile. There is a higher spread and effectivity with tuberculosis infections. We have a problem with control with medications, preventive therapy, observing the compliance with therapy and adherence with therapy. These are systemic issues, healthcare worker shortages, frequent healthcare disruptions from industrial actions and strikes. When these things happen, patients can come in and procure their anti-TB medications and all of these things. So we still have a long way to go before, yes, we actualize the dream of having a world free of tuberculosis, not just certain countries free of TB.
Oh, great. So I was going to ask you this just before Queen jumps right in. Is it correct to narrow tuberculosis or restrict it, as it is the case with non-health workers, non-medical experts, all right, to just coughing? Because sometimes when people cough profusely, they cough continuously, we say, well, this person most likely has tuberculosis. Is that all there is to it?
Okay, not really. So tuberculosis is an infectious disease, meaning that it can spread from one person to the other. But how does it spread? Okay, that's the concern. Now, it is true that coughing, especially cough that has gone beyond 2 weeks, should increase our index of suspicion of possible tuberculosis. That is the teaching. That's our understanding. When you have prolonged cough for more than 2 weeks, think TB. When you have prolonged cough more than 2 weeks, you should be worried or concerned about tuberculosis. And that's you visit the hospital, seek for healthcare interventions. That's beyond coughing. there's more things with tuberculosis, right? Although it's commonly with the respiratory system, that's the lungs, the infection goes to the lungs. But we have seen in tuberculosis that it can also reside in other organs, like the kidneys, like the spine, tuberculous kidneys, etc. But in this particular instance, when we come to respiratory tuberculosis, that is the only time where the tuberculosis infection can spread. If the TB is in your kidneys or the TB is in your spine, it can't spread to another person. But it's only when when it resides in your lungs, that's when it can spread. And when it resides in your lungs, you have respiratory symptoms like cough, prolonged cough, you have fever, you have what do they call it, night sweat, drenching night sweat. So you see patients sleeping on the bed in the night, whether there is a fan or air conditioner, they are waking up in a pool of sweat, that kind of thing. And unintentional weight loss, you never plan to lose weight, but you are progressively losing weight, and that is when you have symptomatic TB. However, it's important to stress at this point that millions of persons who have tuberculosis have latent TB without symptoms, TB without an clinical manifestations. So the TB, you have been infected, but it's just dormant, waiting to be activated, waiting for the right opportunity. And most times the right opportunity presents itself when your immune levels are low, when your immune levels are depressed. Probably you have another coexisting disease like diabetes, like HIV, you are an injectable drug user, IV drug user, or that's for patients who abuse drugs, in this case, not medications. Then patients who have, what do they call it, risky exposures, health workers who are working with patients who have high risk for TB infections. So basically, so on one hand, yes, your high index of suspicion should be increased with cough greater than 2 weeks, fever, drenching night sweats, unintentional weight loss. But it is possible that you have tuberculosis without any of these things. For even as much as 10 years, 3 years, 5 years, you may have been carrying a latent TB. But with latent TB, you can progress to tuberculous disease, the one which has manifestations. And if your tuberculous disease is not well treated, it can be fatal, can result in death. But the route for transmission is from respiratory tract. It has to be coughing, it has to be singing, it has to be with activities where you are able to release droplets into the air. You can't transmit tuberculosis by kissing, by sharing toothbrushes, by laying hands on bed linens and all of that. So that's basically it.
Okay, Dr. Daniel, we have just spoken about, you've just mentioned, how tuberculosis cannot be and can be transmitted. But I want us to go to the very fundamental. What are the most common signs of tuberculosis? And like you mentioned, I was going to ask, but you already did in your intro where you said it is more endemic in sub-Saharan, in the sub-Saharan countries in Africa. I want to know, how can this be managed? What are the challenges that people with tuberculosis face in this part of the world? What are the challenges and how can they be, effectively managed? Okay, I think we have a beat.
Okay, the first question was about the signs, common signs, and I said and symptoms rather, because science is for us, the healthcare practitioners, what we elicit when we examine these patients, what the consumers, what patients need to know, what the population needs to know, symptoms. So we said cough, especially cough, chronic cough of more than 2 weeks, especially when you've had contact with persons who have cough, adults, persons who have chronic cough also. We said fever, that's temperatures greater than 37.4. We said drenching night sweats. We talk about unintentional weight loss. You may be coughing and you may be coughing out blood. You should think tuberculosis. So those are the common symptoms of TB. Now, TB can also affect other places, other sites, like I said, the spine and the kidneys. And in those cases, wherever they affect, the symptoms resemble those systems. If you have a TB spine, like in Pott's disease, you'll be seeing back swelling toward the lower back, wherever the TB infection is, on the spine. There are certain persons that have it, there is a deformity, you have pain around that region, you have difficulty working and maneuvering yourself. So that's basically the symptom. Then what is the problem? Our peculiar sub-Saharan Africa, what are we facing? We're facing the problem of fragile health systems. Our health systems are not as robust as they should to be able to manage infectious diseases like tuberculosis. We are making some improvements with global support, global partners, the United States, AID, and all of that, and even the World Health Organization. But to a larger extent, the systemic issues that prevail or are prevalent in our own region affect our race toward elimination. We may reach a point where we are saying that in the elimination of tuberculosis, the world has left Africa behind, sort of. Now, what are the issues? The issues range from the healthcare practitioners. We have a healthcare worker deficit. We are far exceeded the WHO recommended ratio between healthcare practitioner to patients. That's number one. It means that there will be more burden. Doctors will be more overworked. Healthcare workers will be more overworked. There will be less. We're having problems with disease surveillance. Okay, we also have the problem with misinformation or poor health information or poor health literacy. Somebody is coughing and coughing. You come to the hospital finally. When did the cough start? It started 2 years ago. I was coughing for 8 months. I was coughing for 6 months. I was coughing out blood. And all of these things happened. You are at home. I was drinking honey, I was taking sugar, I was taking cough syrup to cough suppressants and all of that. And you're not bothered about coming to seek intervention from the hospital. And this can be a myriad of reasons, from poor health literacy to the associated health cost. You know, we're having a problem with health insurance services in Nigeria. Only 4% of Nigerians are on health insurance. So it then means that anybody who is coming to the hospital is having at the back of their mind, by the time I come, they will tell me to do certain investigations, certain tests, and all of that. And then we also have a defective primary healthcare system. The primary healthcare system are supposed to be the closest ones to the patients. They don't provide sophisticated levels of care as you expect in a secondary facility or in a tertiary hospital like teaching hospitals. So the primary health centers are in your domain, almost on every, at the street level. The person with cough goes in there. They know the protocol for TB, but patients do not access those services because most of the primary healthcare centers around them are barely functional. They are just empty buildings, poorly equipped, poorly staffed. So until we fix our primary healthcare problem, we may be left out in the race toward eliminating tuberculosis. The beginning at the end point, the start point for tuberculosis elimination begins with diagnosis. And diagnosis will require testing modalities. We have simple testing modalities to know whether or not this person has been infected with tuberculosis infection in the very first place. And that includes testing like the tuberculosis skin test. It's a simple skin test. Anybody can do that in a primary healthcare setting, or a blood test for interferon gamma assay. Okay, that's beyond the scope of this particular conversation. But these testing modalities will not tell us whether or not this person has tuberculosis disease. That they are at the stage when they can transfer to another person or where the disease is manifest. And so at that point, they may need to collect their sputum. When they cough out, that thing that comes out that may be yellowish, brownish, reddish, whatever it is, the sputum, we collect it for a sputum test, or we do a molecular assay. Now, a molecular assay is not randomly done in the laboratories around. You need molecular laboratories. And Nigeria has a deficit with those molecular laboratories. Most of them are domiciled in tertiary hospitals. And there are very few per state, per region. There are few. So we're having problems with maybe patients having access to PCR. Who pays for these tests in modalities? Then you've been confirmed that you have tuberculosis infection. There is treatment and it's free. And the treatment is directly observed therapy. It means that if you are going to take your tuberculosis medication every single day, a healthcare worker is supposed to observe you take the medication because we don't want to run the risk of having drug-resistant tuberculosis. That's the biggest problem the world at large is going to face when it comes to eliminating TB. There are medications that are potent against tuberculosis, which if you commence, reduce your likelihood of transmitting the infection. But if you develop resistance against these medications, then we have a serious problem. Because when you cough and you release those droplets, the infection that you infect another person is not just TB, but it's a drug-resistant tuberculosis. Meaning that when we give that patient the right medication for the drugs, the routine medications, they may not be effective for those patients. So we try to tackle the issue of drug resistance. But you know where we are in sub-Saharan Africa. Problem of compliance and adherence. You give a patient medication to take every single day for 12 weeks or for 10 weeks. We did take it every single day. That's why you need the DOT. Now, DOT, conventionally, patients will come to the primary healthcare center, be observed that they are giving their medication on the spot with a cup of water, they take it. But right now, it's not so feasible. People have busy lives, schedules, and all of that. The world has moved forward to video DOT. That's you just make a video call with your healthcare practitioner. This is the medication I want to take it, swallow. And those services are available. Internet penetration in Africa, huge cost of data, accessibility to smartphones and etc. Yes, the situation may not be ideal, may be ideal.
All right, you're welcome back from that point of view of a medical practitioner. I hope you were well informed that TB has different gravities when it comes to when it reaches that tuberculosis stage. There are stages that gets to that point. I remember you mentioned, Queen, you mentioned about the one that you see the doctor and then you...
That he just mentioned, DOT.
The DOT, as in you see the doctor and then you're taking your drugs, your prescriptions rightly for that particular time, and then you're good to go. It's not a deadly disease, not a death sentence, except if it is not well managed. So, of course, the theme for the United Nations World Tuberculosis Day is, yes, we can fight tuberculosis. All right, now that's so much we can take. And a big appreciation to my colleague, Queen Agaba, who is here. I had to bring you on the program because you were on Global Morning with a legal practitioner and he spoke extensively. So I want everyone to say, okay, what's the mix for you to understand that it's a continuum of what we spoke about in the morning on Insight
Absolutely
today.
a delight to be here.
Thank you so much, Queen Agaba, for being a part of Insight today on Global Television. Well, that's so much we can take. And yes, we can fight tuberculosis. It takes you and I, okay? Let's not rely on the government alone. And believe me, it is not a death sentence. Once you have your right medicine, once you see a medical practitioner, you will be fine and you will be okay. All right, now I am Jumai Manson. Thank you for being a part of Insight today, and see you tomorrow. Bye-bye.